How do new imaging techniques distinguish dementia types? Imagine being able to see inside the brain and tell exactly what kind of dementia someone has. That's now possible thanks to new imaging methods that go beyond traditional cognitive tests. These advances help doctors identify specific dementia types by analyzing brain activity and structure with remarkable precision. One of the most exciting developments involves artificial intelligence and brain scans called fluorodeoxyglucose positron emission tomography scans. These scans measure how the brain uses glucose for energy, which varies depending on the type of dementia. Researchers at the Mayo Clinic created an AI tool called State Viewer that compares individual scans to a large database of over 3,600 scans from people with confirmed dementia and healthy individuals. The AI recognizes patterns unique to each dementia type. For example, Alzheimer's disease usually shows decreased activity in memory and processing regions, while Lewy body dementia affects areas involved in attention and movement. Frontotemporal dementia impacts regions responsible for language and behavior. The AI displays these patterns with color-coded maps, making it easier for clinicians to see exactly where the brain is affected. This technology has improved diagnosis speed and accuracy, nearly doubling the speed and tripling the precision compared to traditional methods. Another breakthrough involves advanced magnetic resonance imaging, or MRI, which can detect tiny changes in brain tissue before visible shrinkage occurs. Researchers at Karolinska Institutet developed a special MRI technique that measures how water molecules spread within the brain's gray matter. Increased water diffusion indicates microstructural damage, revealing early signs of dementia even before symptoms show up. This method is especially useful for detecting hereditary forms of frontotemporal dementia caused by specific gene mutations. It can identify brain changes in people who seem healthy but carry risk genes, allowing for earlier intervention. Speeding up the process even more, scientists have developed faster MRI scans that take only about 1/3 of the usual time. Using parallel imaging techniques, these quick scans maintain the same diagnostic reliability as standard scans, but are completed much faster. This means more patients can be scanned in a day, reducing wait times and making the process less stressful. Shorter scans also lower costs and improve patient comfort, especially for those who find MRI machines intimidating or uncomfortable. Guidelines from major health organizations now help doctors decide when to use these imaging tests. For example, the Alzheimer's Association recommends using amyloid and tau positron emission tomography scans only when results will influence treatment decisions, such as confirming Alzheimer's disease or determining eligibility for new therapies. These scans detect hallmark features like amyloid plaques and tau tangles in the brain, which are key indicators of Alzheimer's. Clear protocols ensure these powerful tools are used wisely and effectively. All these imaging advances are changing how we diagnose dementia. They fill a critical gap because many people with dementia remain undiagnosed or misdiagnosed. Early and accurate diagnosis opens doors to better care, support, and treatment options. As technology continues to improve, researchers are working to make these tools reliable across different hospitals and patient groups worldwide. This convergence of artificial intelligence, faster MRI techniques, and targeted imaging protocols is transforming dementia diagnosis, helping clinicians distinguish between types with unprecedented speed and accuracy. Remember, always consult healthcare professionals for personalized advice, as individual experiences with dementia can vary widely.